Hi, I'm Rebecca Leon. I'm a practicing GP and a GP cancer lead for GatewayC.
And I'm Sarah Taylor, also a practicing GP and GP lead for GatewayC.
And together we host the GatewayC podcast, GPs Talk Cancer, the series where we bring real-life patient stories and specialist secondary care guests to share their knowledge and their insights. With each episode, we focus on a specific site, symptoms and any issues related to early diagnosis.
And we're just coming to the end of recording our second series, and we have learned quite a lot along the way, haven't we, Rebecca?
We definitely have. I remember vividly the conversation with Guy Makin. We were talking about deciding to send a child for a blood test, and I think I've now changed my practice because of our conversation.
This child needs a blood count, doesn't it? You know, you've got symptoms that are making you worry it's anemic, that it's got low platelets, you're worrying that it's getting recurrent infections. You need a full blood count that's going to reassure you one way or the other. If you've got a full blood count that's perfectly normal, it's going to make you feel pretty reassured they haven't got leukemia. But if the symptoms persist, you need to do it again.
And I agree, Rebecca. I think that this has changed my threshold for when to organise a blood test in a child with persistent symptoms. So I think it's one of the key learnings for me from this series. So I've had my conversation with Matt Makin, I knew you were away, about prognostication at the end of life, really helpful.
The gap between reality and expectations is called the Kalman gap. And I often see the Kalman gap as a set of steps.
Okay.
So expectations sometimes is at the top of the step and reality is at the bottom of the step. And the trick is to assess how long that staircase is, what the gap is between expectations and reality. Because if Fred's view of his cancer is, I've got a touch of cancer in my lung, but I think it's all cleared up now, and I don't know why you're here, doctor. You've got a big gap.
Yeah.
We've got to look at whether the right thing to do is to try and take Fred down that staircase. What you don't do is push Fred from the top of the staircase.
That doesn't sound like a very good idea.
He'll fall all the way down to the end up in a heap.
Palliative care in general practice or end-of-life care can be very rewarding and satisfying when done well.
Absolutely.
So another part of the series I really enjoyed and found fascinating was our conversations with Suzanne Roberts. She made haematological cancers a lot easier to understand, and she also talked about what bloods to request if you're concerned.
Absolutely, particularly about myeloma.
For our myeloma tests, we always need that haemoglobin, so looking for anemia, so a full blood count, the renal function, so UNE, a bone profile, looking for the calcium. So unless you've done the other part of the myeloma screen, you will miss about 15% of patients.
A takeaway message also from this particular podcast was how to interpret these results, particularly if they're abnormal.
Yeah, Suzanne has a great skill at making things that are very complicated seem quite straightforward and helping us in primary care. Yeah, we've learnt so much through this series, and I'm sure that everybody who listens will do too.
And there are about 20 episodes for you to dive into, so with loads of good stuff.
And we haven't even talked about our discussion with Liz O'Riordan, which is educational and entertaining.
We know you'll love this series, and also your colleagues too.
The series should be of benefit to anybody working in primary care: doctors in training, nurses, other clinical staff, receptionists and admin staff.
You'll get the series right now via our website, GatewayC. That's gatewayc.org.uk, or wherever you get your podcasts.
And if you've already listened to some of our episodes and enjoyed them, please share your thoughts with us.
We love to hear what you think as we prepare for our next series. Topic ideas and reviews are always welcome. Thank you.